you to all partners who sacrificed their last coin for us to have this strategic plan. May I say that, Your Excellency, Governor, represented by Honorable Dr. Mongela, may I say that this is a strategic approach. It is an integration approach, a multi-sectoral approach, a multidisciplinary approach that sustainably aims at optimizing and balancing the well-being of our people, the well-being of our animals, the livestock, and also the well-being of our environment. For us to have an holistically managed rangeland and environment, it deserved the combined effort of Isiolo County, the partners, and the common mwananchi, who are the consumers of all. We all know that we are here to transform our communities. And the transformative approach is premised in the notion that the contemporary situation we are in as a county, the contemporary situation we are in as a country, and also as the community in our counties, is so erratic, such that we need a transformative approach. And when this integration is embodied in the development of a resilient community, it creates the social, political, economic, and spiritual spheres that influences transformation. All of you, once again, as I hand over this microphone to the moderator. Mimi nilikuwa nadhani tutaendelea kunyeshewa. Nibebe kiti. So thank you very much for giving me this opportunity. Asante sana, Daktari.
Thank you very much, Bwana Chief Officer, Livestock. I'll give the Director, Veterinary Services, to just say a word. 2 minutes, ma'am.
Hapa imejificha sana, unajua ni kona. Zile kamera. Tuko live. Tuko live. Uende tu kwa ile tena. Alafu mbele. Ambia wala hata tume ni hata sitaki hiyo hata bwana nimekalia nini umefanya kwenda kwa hiyo kimefika singia sasa sitiweze weka pande I want to yes. 1 second or just 1 second. Your other group has already said. Thank you, Genevieve, and with coming together is to ensure that we maximize the minimal resources that are available at the county, and also whatever resources has been channeled by our respective partners. Now that we have the strategy, we want to urge the executive to have a look at the strategy. We have outlined a number of activities for the next 5 years. The activities that we want to seek some support from the executive so that we can be able to deliver as One Health. We have outlined activities that have budget line in that strategy plan.
Makofi kwake. Si ameuliza pesa ndio hii huyu mtoto wetu asife akiwa mdogo. Anazaliwa leo na tusimwage na maji ya the bath water. Washa tumlishe na natarajia county itafanya hivyo kumlisha huyu mtoto na kuwe na nguvu. Asante sana. Kwa sababu ya wakati nitaomba partners waseme tu jambo moja. Nitaanza na SCF, Bwana Mwangi, Gerald. Tafadhali sema kidogo tu.
Sorry, allow me sit. Good morning everyone, all protocols observed. My name is Gerald Mwangi, nafanya kazi na shirika la Action Against Hunger. Na kwa leo tunashukuru the county government because of the coordination role that they have demonstrated and the support that we have had to be able to move this far. I know the journey started in 2020 when we were doing the outreaches during the height of the ended drought. Hiyo ndio wakati tulikuwa nafanya emergency response project, and one of the aspects that we were focusing on was on human health through integrated outreaches, especially in the areas of Merti and Oldonyiro. And that's when we came together with AMREF, and there was a request that we can combine the efforts in ensuring that as we focus on human health, there's also the aspect of animal health that comes into it. I can say it has been a success, and when I see this strategy, I know that's one of the innovation or the aspect that you can focus on moving forward. I know we have different aspects, and as Action Against Hunger, we are committed, and it has now become a new focus. Issues to do with the environment, climate change, and zoonosis is one of our priorities moving forward. Otherwise, thank you so much, and thank you.
Thank you very much, General. I'll give my organization, VSF Swiss, Dr. Machuchu, to say a few words.
Thank you, Madam Genevieve. The representative of the county governor, the chief guest, Dr. Mwongela, all protocols observed. If you excuse me to say that because of the time. I want at this point to appreciate every partner, that is the government and the development partners. And behind that, we've been driven up to this level by our able donors. They have been very, very kind to us. If I may mention, for example, the EU, which really was there from the beginning under the DRIC project, which is initiated this One Health. And also prior to that, we had, for example, for us in VSF Swiss, we had BioVision Foundation, who have been with us since 2010, and especially in the support of the grassroots reporting of diseases, where we initiated the process of reporting using a platform on a mobile phone, and we linked that up with the national one so that we are able to monitor diseases and report them real time, and that has really improved a lot. And as we've learned that these diseases, some of them, zoonotic diseases, do come from animals and sometimes even from the environment itself into the humans. I can attest to witnessing here in Isiolo, where this One Health has worked, especially as you've heard severally, that we were able to manage the outbreak of Rift Valley fever. Broadly, we are looking at zoonotic diseases, and we are also looking at antimicrobial resistance and food safety. Just a small contribution to ensure that that all this is represented. Partners have supported the establishment of MSIPs, that is stakeholder innovation platforms in the various wards, and these are helping to bring partners or community members together to discuss issues of One Health, and this shows that we have been able to escalate this down to the ground level. With further support, we mobilize resources from the government, and we ensure that this cost-effective approach is supported, and we'll be able to deliver the One Health and other aspects that can drive the development of our people forward. Thank you very much.
Thank you very much, Douglas. Next, I'll give AMREF. And the AMREF officer is running away, so I'll give Mama One Health.
Habari zenu. I take this opportunity to thank the executive. We want to recognize that we have worked closely with the Isiolo County government from the beginning, and our entry as AMREF is to work with the county government. We have worked with you alongside with other partners and the community, and ours is to change the communities through the One Health approach and through the multi-sectoral approach. The takeaway home for the county government, now that we have launched this strategy, is that through the initiative that we have, through the One Health program, is to see the scale up of the outreach program to other hard-to-reach areas. I know we have just a few outreaches mapped through the 3 pillars of the migratory, and probably we have more that are still pending. We also have the challenges of how many community actors we have reached in sensitization of this approach and the healthcare workers. We look forward through this strategy. We know we have a lot of a budget here that will go a long way in 5 years to see that we scale up this approach in all the village levels and household level. And looking forward, I want to see in 5 years where we are going to challenge the 46 counties that we are doing the best. Thank you very much.
Thank you very much, Mama One Health, as she's fondly known in Isiolo. And I'm actually fondly known as Mama Maziwa. Not that I love Maziwa, but I like working with women who sell milk and who do business in milk. When we started this One Health, the One Health unit in Isiolo, this thing was actually borrowed so much from the zoonotic disease department at the state offices, and we are glad that today we have a representative from the ZDU. Daktari, karibu sana. Tell us more about the ZDU and the difference between ZDU and One Health. Thank you very much.
Thank you very much, Madam MC. Allow me to stand here. The rains have subsided. Our chief guests, Dr. Lawrence Mongera, all other protocols observed. My name is Matthew Mutiria. I work for the Ministry of Health at the National One Health Office. And I want to say that I'm excited this day to be able to stand here and join you in launching this One Health strategy for Isiolo County. I want to say that on behalf of the Ministry of Health and on behalf of my immediate boss and my own behalf, that Isiolo County has demonstrated a commendable job among the 47 counties that we have. Today, if all of us remember, is a day that Isiolo County agreed to commemorate the One Health Day that is normally that's normally commemorated on 3rd of November. And because 3rd of November came on Sunday, Isiolo County agreed that they can be able to mark this celebration through or by supporting this journey or developing this strategy. And so for us at the national, where we have a strategy that MC asked me to give a difference